All right, so this is Meg again. We're going to learn about dermal puncture, and the majority of the testing you're going to be doing with a dermal puncture is blood glucose. This is what they call what they use for blood glucose when you get what they call a finger stick. So this is going to be what you're using for the blood that you're drawing for a dermal puncture. There's going to be certain situations where only a small amount of blood is required for testing. This is for things like blood glucose. It's being drawn from an infant or a small child, or from an adult whose veins are difficult to find. If either of these situations should arise, it is advisable to perform a dermal puncture or a microcapillary collection on the patient, which is almost the same thing. These are reasons for performing a dermal puncture. Ancillary blood glucose testing. Children under the age of 2 usually don't want to use a needle to draw blood from. You're easily able to get blood from them from just sticking their finger or their heel, usually their heel. Geriatric patients, a lot of times it's difficult to find a vein on a geriatric patient, so you just want to draw a little bit of blood from their fingertip. Obese patients, sometimes they have a layer of fatty tissue over top of their veins, so sometimes it's very difficult to draw blood from them. Patients at risk for venous thrombosis, patients requiring frequent blood tests because you don't want to get scar up their veins with a lot of actual needle sticks. Patients with burns or scars over venipuncture sites, and then any bleed time testing. So when you do a dermal puncture, you're actually drawing blood from a capillary, which we have gone over quite a bit in anatomy and physiology. These are microscopic 1-cell thick vessels that link arterioles and venules that form a bridge between an artery and a vein. So they're going to hold they're going to hold oxygenated blood in there. They're the only vessel that permit the exchange of CO2 and O2, or carbon dioxide and oxygen, between blood and other tissues. And the blood in a capillary bed is a mix of arterial and venous blood. And this is just a picture of the skin puncture devices that you're going to use. They're different sizes, different lengths of needles in the different colors, but I'm sure at some point you guys, if you're just been anywhere in the medical field at all, you've probably seen one of these devices. Skin puncture devices, they automatically puncture. All you have to do is click a button. They deliver a swift puncture to a predetermined depth, depending on the color of the one you've pulled out. Lassiter laser lancing device will use a laser rather than a sharp instrument to pierce the skin, and it causes less pain and bruising at the sample site. Most people still just use the automatic puncture devices, though. It's quicker, easier cleanup, just makes everything a lot more succinct. To do a dermal puncture, you're going to need things like alcohol pads, gauze pads, a sharps container where you dispose of the lancet, and then a heel warmer for like a baby. You want to warm up that area to get the blood flowing, because even though babies don't have the thick skin that adults have on their heels, it's still an area that's harder to draw blood from. The sites that you're going to want to use for capillary collection are going to be fingertips, obviously, the heel on a baby, and also an earlobe. You can get blood from an earlobe. I would always try the fingertips and the heel before I try an earlobe. The puncture depth and width depends on the site of the patient and the patient. A lancet should never penetrate more than 3 millimeters on a finger stick, because obviously you're going to go, the thin fingers are not that thick. You don't want to go too far in. 2 millimeters on a heel stick, and 0.65 to 0.85 on a premature infant. or a neonatal heel stick, or 1 millimeter for a bleed time test. So these are things that wherever you work, it's going to be in your policies and procedures, but this is basically the outline of exactly how much you want to penetrate each area and each different type of person. We've also listed the capillary collection procedure. This is going to be one of your easier procedures that you're going to perform in class. We'll just be doing this type of thing a lot. Most people, it's not too difficult to draw blood from a capillary collection. You just want to make sure that you're always massaging, like for instance, the finger. You want to make sure you're massaging it, pushing blood towards the fingertip till the fingertip turns red, because you want to make sure you have as much blood as possible, because if you don't end up penetrating your maximum length, sometimes it's difficult to squeeze blood out. So you always want to make sure that you're massaging the finger, getting blood flow to it, keeping it warm. If someone's fingers are cold, you want to make sure that you get them warmed up before you try to do it, because cold fingers indicate lack of blood flow, and that's the last thing you want when you're trying to get blood is cold fingers with no blood flow in them. So if you just want to go ahead and read over the capillary collection procedures, I'm not going to read it to you. You'll be doing it quite a bit. It'll become like second nature by the time you're done with this class. And here's the balance of the 16 steps. As I said, we'll be doing this quite a bit in the lab portion of the class when you actually come to the school. It's not a difficult procedure, so it's not something you want to stress over. So if you have any questions, please send us an email. We'll be happy to answer any of them, but as I said, you'll be doing this quite a bit. You have to have so many of these finger sticks in class, so it's a relatively easy procedure. So let us know if you have any questions, and good luck.